Thank you for joining us today. I'm Guy Carrick with St. Elizabeth Healthcare in Northern Kentucky. Today we're going to be talking about a procedure called dry needling, and we have a physical therapist right here with us who will describe the procedure. I'd like to remind viewers, if you do have any questions, please submit them on the comments section. And I'd like to introduce our physical therapist, David Stettner with St. Elizabeth. David, if you could briefly describe your role and what you do for viewers for us.
Sure. I'm a physical therapist with St. Elizabeth, as you said. I've been with the hospital for 20 years, and I primarily practice in orthopedics, and I treat all kinds of musculoskeletal disorders.
Okay. Well, before we get into the questions, I'd like to once again remind viewers, if you do have any questions, please submit them on the contents page. So right now, David, I think our first question, if you could just describe dry needling and its benefits.
Okay. It's the introduction of a solid filiform needle into what we call a trigger point, or into the tight bands of the muscle, to try to help release the muscle. And the benefits of it is that we can get directly down into the tissue. Moreover, where we used to have to do surface myofascial type techniques, which I still do and many of other physical therapists do, we can now get into this tissue more intimately and release them almost immediately.
Okay, and what are some of the additional benefits with dry needling?
We can get to tissue that's deeper than we can with our hands. It's a much more immediate and long-lasting treatment as well, versus doing some sort of soft tissue massage or mobilization, where commonly the results are lasting hours. With dry needling, a lot of times we can see a person who's had pain for weeks and it go away in a single treatment, and it lasts for days. So it helps us with our treatments move on from one stage to the next.
Okay, and from a patient's perspective, why would it be beneficial to a patient?
They can get better faster. We can move through the phases of rehabilitation more efficiently, and if they're willing to go through a short-term discomfort, the long-term benefits really outweigh some of the length of time we've had to use in the past to take care of their musculoskeletal issues.
Okay, and how would I know, or how would a patient or someone who's seeing this know if they're a good candidate for dry needling?
Typically, they would go to their physician first and get a referral to a physical therapist. Most folks have some sort of soft tissue problem to begin with that's evaluated by their physician, and then they would come and we would do an evaluation as well. So we would spend 45 minutes to an hour on their first visit examining them, getting their history, and going through all the tests that we do as physical therapists to make sure that they kind of fit the profile for what we need.
Okay, and earlier you mentioned something called a trigger point.
Mm-hmm.
Could you expand on that and describe what a trigger point is?
Sure. It's a tight band in a piece of tissue that typically doesn't lie in parallel to the fibers that should normally be in their position. So I commonly use an example of if a knot were in a rope. So a rope would typically have a nice uniform pattern, and typically patients will come in with a tight spot within that rope. So it would be as if there was a knot in the rope, and the rope was like this, and you couldn't get that out with just undoing it with your hands. We would use a needle to go in there and open that tissue. So we would put the needle in between those fibers, much like you would a knot in a rope, and then free up that knot so that the fibers can move back and forth like that, the way they're supposed to.
Fascinating. Now what you're describing, also to me, it sounds a little bit similar to acupuncture.
Mm-hmm.
So at this time, could you talk about the similarities with dry needling and acupuncture, as well as what some of the differences are?
Yeah, that's a pretty hot topic between the two groups of folks that practice each of those techniques. And so both camps would say they're very similar. The acupuncturist would say that a dry needler is doing a form of acupuncture, and dry needlers would say that we're doing dry needling. Typically, they're used for similar things. Commonly, an acupuncturist will use finding meridians and energy points on a person's body to work with pain as a primary factor, and then secondarily work with trigger points, where the dry needler is also working with pain, but looking right at the muscle tissue first. We're not examining or trained to examine meridian points or areas of energy flow. We're looking right at the muscle system, just like we are trained to do as physical therapists. And so we're going to go right to that trigger point and try to release that for a different rationale.
Okay. And what types of needles are used?
They're technically an acupuncture needle. It's thin, solid, stainless steel, sterile needle of varying lengths depending upon where we're putting the needle in the body.
Okay, and approximately how long does a typical dry needling experience take?
About 15 or 20 minutes. We'll introduce the needles into the tissue. There's a couple of different techniques. Some folks leave the needle in situ, meaning that all the patients there, they just leave the needle in once it's introduced, and then move the needle around in a technique called fishing. There's also another technique called fast in, fast out, where we're just literally trying to release that tissue and then moving on to something else. So it depends on the patient type and what they need as to what type we're using. So.
And what might occur that might make the procedure last just a little bit longer than 10 or 15 minutes?
The density of the tissue, the patient's tolerance, if they need to rest, or it's uncomfortable to some degree. I mean, we're putting needles in someone's body, so some people have some discomfort with that, so they might need to rest a little bit in between each needle introduction. So it just depends on the patient type. So.
Could you talk about how safe the procedure is?
Yeah, we're trained to do this the way that the body needs, and as physical therapists, I mean, we're trained to know how the body works and our anatomy and where things are, blood vessels and nerves, bony tissue. So as long as you're trained appropriately and use the appropriate ethical standards of how you're introducing the needle, it's very safe.
And we'll have to ask, how much does it hurt? How much? I think people
Sure.
know that.
Yeah, it's a pretty common question. Like I tell people, I'm honest with them. I mean, we're putting needles into your body. They're tiny. They're very, very thin. And we're putting it into tissue that's sensitive. You've come to us to take care of that particular tissue, and it's already sensitive. So it can be uncomfortable. Again, it depends on the patient's pain tolerance and what they've had before, and those kind of factors. So, but I generally tell them it's going to be a little uncomfortable. The introduction typically feels like a little bit of like a bee sting at first, and then it feels like deep pressure. But most everybody tells me that it's worth it in the end because of the relief that you get. It feels like that big weight is lifted off the muscle, and they can move a lot better. And so the freedom of movement and the relief of pain is well worth the short-term discomfort that they have.
Okay. And someone who wants dry needling, do they need a physician referral first? Could you describe that for us?
Yeah, they do. They just need an order or referral from the physician for the pathology. It doesn't need to say dry needling. Dry needling is a choice that the physical therapist will make as to the modality that they're using. So for 20 years, I've used my hands as a manual therapist. Manual therapists, do things with soft tissue and bony tissue commonly. And so it's just a choice that we've made in our therapeutic toolbox. And this is just another one of those things. So the patient just needs an order from the physician for, say, neck pain or upper trapezius strain or piriformis syndrome or low back pain or any other body parts that they have problems with. And then we come in and determine whether or not the patient will do well with dry needling or not.
Okay, and could you describe who that ideal patient or who should come in and consider dry needling?
Yeah, somebody who's had muscle or soft tissue pain for a while that they can't take care of on their own with stretching or medication, and they're just having trouble moving, or they can feel that knot themselves if they poke or palpate on the muscle tissue or soft tissue somewhere, and they feel like they can't loosen that themselves. So that's a good candidate.
Okay. Well, I do want to remind viewers, we do have the procedure live today. We do have a patient with us. So I do want to remind, if you have any questions, please submit them using the comments section. Now, I think at this time, let's go ahead and introduce and bring our patient in.
Okay, sounds good. Hi, Whitney. Thanks for being here. I appreciate it. So you have a neck and shoulder problem, is that correct?
That's correct.
Okay. And you slipped on some stairs and caught your arm on the railing, is that right?
Yes.
Okay. And so this just happened a couple of days ago?
Correct.
All right, very good. And so it hurts in your neck and shoulder. Can you show me where?
Correct. It's more right in here in this area. It's pretty tight, but it kind of goes up and around.
Okay. And that's how you would describe it, as like a tightness there?
Yes.
Okay. And do you have a headache with that as well?
No headache.
Okay. And you have a problem moving your arm at all, or any numbness in your arm?
No numbness,
Okay.
no, just a little stiff, feel I need to stretch often.
Okay. And you've not dropped anything you've held in your left arm or anything like that
Correct.
this morning? Okay. So what would you rate your discomfort this morning?
It's more of a discomfort more than a shooting pain, but it's probably about a 4.
Okay. And it's just a tightness?
Yeah.
Okay. And I've explained the procedure to you before we came on camera, so you're comfortable with that.
Absolutely.
And you understand the precautions.
Yes.
Okay, very good. Well, let's get you on the table, and we'll get you in position, and we'll get started.
Perfect.
Okay. All right, so we're going. All right. Alright, so we're just going to use a little alcohol here, okay?
Okay.
So just keep things clean. So you said most of your issues were right in here,
Yeah.
and a little bit up in here,
Yeah, kind of down a little further.
right there where my thumb is?
Yeah,
Okay,
yeah.
okay. Alright, so we know we've got a trigger point, or one of those tight bands that I was talking about earlier, is in her upper trapezius muscle right here. So commonly that muscle comes from the shoulder up into the neck, the base of the skull. So it's appropriate to needle kind of the excursion of the muscle. So we're just cleaning her off with a little alcohol here. All right. Alright, so we're just going to go right here into the semispinalis cervicis area. So we just palpate her spine and come off the edge right here. And we're about C4-5. You okay?
Mm-hmm.
Okay. There we go. There's more. We go a little bit lower here. There's C7. Right there. A little tension here. Okay, just breathe for me. Good job. Good job. Very good. So, I'm going to go into those stitches. You okay?
Mm-hmm.
Okay. Just relax there for me. There we go. Yep. You feel that?
Mhm.
Yeah, I did too. Good. So you can feel that tension when we do this. So you can palpate it superficially, and then when we get in there with the needle, it gives you the opportunity to really feel what the patient's feeling, because you're down in there deeper. So you're actually getting to the point there that's tight right there, right?
Mm-hmm.
Okay. Good. So one of the techniques we'll do up in the cervical spine would be to turn these needles a little bit to wind around that tension. So you don't have to do it very aggressively. There's a subtlety to it. And so you can see the needle turning just a little bit because you want to force that relaxation. And then over here is where we would do kind of our fishing technique, where I come back and forth. And she can feel this. Good. See that twitch right there? That's exactly what we're talking about. That's called a localized twitch response. So that twitch right there is exactly what we're looking for, and that's the point, no pun intended, of doing this treatment. You're not really going to get that with a strain counter strain or a myofascial release. Oh, there we go again. So we're literally releasing that muscle. You okay?
Mm-hmm.
Okay, there it is again. So she has a large trigger point right here that we're seeing release literally. Okay. So just to avoid some soreness, I'm not going to be too aggressive because folks are generally sore. It feels like a really good ache for about 24 hours or so, and then we get that release throughout that process. So she's just going to relax today, no heavy lifting. She's going to drink appropriate amounts of water and just allow herself to relax, so we're not asking the tissue to do more work than necessary because we want it to relax and unwind, as I noted before. A little bit of release out here, but not as big as this one. So that's the procedure right there. So we'll take these out. So every once in a while there might be a drop of blood, but commonly there's not even that. So we'll get these out. There's a little bit of redness, again, just from the introduction of the needle. And we'll just wipe her off one more time. And also we get some increase in blood flow here too, because there's a theory that there's a dryness to that tissue that's been bound up, and we're releasing that flow of blood and good chemical into the tissue there. So that would be that, and we'll let Whitney get up and go
David,
from there.
we do have a question from Brad. How many times would a patient need to have the procedure done not to experience pain?
It depends on the patient and the situation. So I've had patients where we would just do this treatment alone. She had this done a couple of days ago, or this happened to her a couple of days ago, and we would do one treatment and she'd be fine. We'd get onto some exercises and do a more traditional approach to therapeutic exercise and physical therapy, and she'd be good to go maybe in a week or so, less than. We've had patients with chronic conditions for over a year that we might have to use 4, 5, 6 treatments for to release the tissue. Also, if there was a larger area, so if we were doing the neck and the back, obviously that's going to take more treatments. But typically, I'm going to change what we're doing in 4 to 6 treatments if we're not getting somewhere, we're not releasing tissue, pain hasn't decreased, function hasn't increased in 4 to 6 treatments, then I'm going to do what I would normally do as a clinician anyway and make a change in what I'm doing.
Okay, and now that we've seen the procedure, we have another question from Sue. How is this different from acupuncture?
The differences were kind of, as I noted, the theory is different in that you're looking at 1,000 years of Chinese medicine, looking at meridian lines and your energy flow and trying to control that flow. But some of the technique is the same in doing that. Some acupuncturists will actually kind of do what we're doing here in that they're looking at a trigger point as well, and that's where things would be very, very similar. And in fact, you may not know the difference between the 2 treatments depending upon the acupuncturist or the needler. But commonly they would start from a different theory versus where I just go right to the muscle and release the tissue. I'm not looking at flow of energy or meridian points that might be elsewhere on her upper back that an acupuncturist might look to kind of control that energy flow and put needles in different spots with a different technique.
Okay, and another question, this one from John. Do most insurance plans cover this?
Yes, it's billed as a manual therapy because it is literally a trigger point release, just as I would have done in the past without this training. I was billing for manual therapy because I would do, like I noted while I was doing it, like a strain counter strain or a myofascial release technique. So it's billed as manual therapy.
Okay, and who should someone contact if they're interested in dry needling?
They would first go to their doctor, as we discussed, to get an order for the treatment with the diagnosis from the physician, and then they would just schedule with us I'm at the Burlington location at the Y, and that number is 212-4200 if you needed it, but that's where I am, that's where I practice, so they can call that number and get scheduled.
And one more question, David. Why is it important for someone to get a physician referral first?
It's a requirement from the hospital. St. Elizabeth requires us to have an order from the doctor, and most insurance companies require that as well. So we can bill through their insurance for it.
Okay. Well, that wraps up all the questions that we have today. I'm sorry, we have one more from Matt. How does dry needling work with plantar fasciitis?
It works well. I've had several patients that work with plantar fasciitis, and they get a good release out of it.
Okay, and I do want to remind viewers, feel free to submit any questions on the content section, and we will respond to each of your questions. And in closing, David, I really want to thank you for being here to share your knowledge. Whitney, thank you for demonstrating for us live today. If you want to subscribe to future Facebook Live events at St. Elizabeth, feel free to come into our Facebook page and do so. And at this point, I'd like to thank David and our viewers for joining us today.
Thank you.